Everyone, I have a nice lady here, a wonderful patient of mine. I just saw her for a consult not too long ago. She was able to basically exchange her date to a much sooner date, literally the following week, and she is now 6 days out from her surgery. Now, let me ask you this. How are you feeling now versus what you did, like, say, a week ago?
I feel 100% different. I feel fantastic.
Like, in what way?
So my body feels like instead of drinking out of one of those little straws you stir coffee with, it feels like the biggest straw ever, this sludge in my body. I feel light and feather. I can breathe and my rib cage is contrasting and expanding. My color of my skin tone is back. I have oil on my skin again, and my wrinkles almost seem like I look 5 years younger at least already, it feels. My mind feels clear. I can have conversations with people and want to speak with them, and I'm not worrying about myself or feeling what's going on inside and trying to focus on them. I'm just focused on others.
No, your mom just said that your personality is coming back, the way and who you were before. Tell us more. What is that? Or mom, if you want to say anything, that would be great, because sometimes you notice it, but then there are others around you, your significant others, family. If you want to say a few words, you can certainly do that.
Okay, go ahead, Mom.
Her humor has really increased just in 6 days. Her bubbly personality has come back, and she has gone outside of herself to be interested in her family members, and like she has not been in a long time.
And this is
beautiful.
and this is the irritability, emotional instability, the depression, the anxiety, all of that, and this is the part of BI that is very much real, so this is real. Now tell us more about other symptoms, how you have improved.
So my ears, I've been struggling with my ears, had just felt swollen and things were in it more or less, and my hearing is so wide open, and the swelling that I didn't even realize was necessarily there, it's gone. My neck feels so loose. The tension that is no longer pulling is so weird to me. My eyes, the whites of my eyes are so white and clear that I didn't even realize that they weren't before. It's scary, like, just to see it, to know how bad it really was. And I knew how bad it was, but then to feel it now is just so surreal.
Now, thank you very much for sharing that. Now, this is very deep, very important and huge as far as, the other patients, the heal is real for someone young like you, right? Look at the symptoms where you have, and this is patient after patient, and this is for the FDA, this is for the other plastic surgeons, the other rheumatologists. This is not a patient who is going through the stresses of life. This is the stress of the implant. Now, how was your anesthesia experience?
Oh, it was wonderful.
Yeah.
I don't have any complaints, I guess. There was no crazy headache. I wasn't waking up struggling to breathe. So with past anesthesia, I would wake up freezing and shivering. I couldn't breathe. They would, Jessica, you need to breathe. And I woke up and it was, my shoes. And I was just very happy, and life was great from that moment.
And this is what I say, Twilight is the way to go. General is still very safe, don't get me wrong, but this is better, safer, more comfortable anesthesia where we have the effects are much less, and the bounce back is very natural. Now, as you saw yourself, you did not need drains, right? And then as far as you did not need a lift, right? What lift when you would put the nipples even higher, but you're exactly where I would want them as a plastic surgeon, right? And then I cut out the excess skin on the sides because this is where you were lateralizing. And I remember this was the heavy Ethabound suture that I removed that was coat in the proximity of the skin where it was cinching and kind of pulling on your skin. Where your doctor had given the steroid shot. So I removed all of that, plus the steroid shot affects itself and the tissue around. And so now it's, again, very happy to hear your feedback. And, we'll continue to hear from you. Now, 2 other questions for you. What would you say to the other person who's listening and say this is all in your head? Maybe this might be the Percocet you're taking.
It is not. It is not at all.
Now, let me ask you this other question. So initially you did well with the pain, right? Tell us
Correct.
more about your pain course.
So for the first couple days, I had taken the Percocets, and I would say by the end of day 2, I was to the Tylenol and Aleve. And then now, as the last 2 days, I'm taking a Percocet at night just to help relieve with my body to allow my shoulder to just relax and allow it to heal. But,
No, I think this might be just maybe an overuse of the right arm reflexively at night, because remember, now no big worries. Your exam is very unremarkable, and so we'll see how it settles. So this is consistent with a good 2/3 of my patients, where for the first 2 days or so they take the pain meds and then they wean. And certainly we'll see how you do, and you wean off the pain medications. I feel that you might have just pulled your arm. Now, how did you hear about me as far as BII and explant, and how determined or motivated were you before you did the surgery?
So my mother found you on Facebook, and it just felt like a godsend when she sent it and all the information, and what a blessing it felt like that you were here only an hour and a half away. We didn't have to go out of state, though I was willing to go anywhere at that point.
Before your surgery, how convinced were you that this was it?
100%. I was convinced last year when they took them out and convinced me that I had to have them replaced. I was wanting them out, removed, do not put them back in, and they said, nope, can't do it because the capsule feeds the oxygen, it has the blood to the skin, and if we remove it, you're going to have black skin and it's dead and you can't have that. And they literally basically told me no. And I was so upset by that. And to find that I can, and here I am, and everything is well. It's better than well.
Yeah. And then, I will end with this. Just look at your pathology report. It says refractile light consistent with breast implant particles within the capsule. So if anyone says that you don't have to take the capsule out, I say just look at this pathology report.
right.
It will speak for itself.
Yes.
So,
Yes.
no, again, thank you very much for sharing the journey. Hopefully everyone finds this informative, including the many other plastic surgeons, and hopefully the many administrative health societies, not only in the U.S. but elsewhere, that, you are a victim of these implants and you have nothing to worry about as you live happily the rest of your life, which much eagerly awaits you, without any tension, without any mental stress, physical stress, emotional stress, whatever it may be.
Hallelujah.
All right, thanks.